The Dan York State of Mind program is brought to you in part by Lookout Rhode Island and Takeo Comfort Solutions.
Good evening and welcome to my State of Mind. I'm Dan York. Amidst all of the turmoil that we have in Eastern Europe, and its turmoil, no doubt about it, something that we're continuing to focus on here on WPRI and on WPRO. Last week there was a monstrous decision that came out of the Attorney General's office regarding the ongoing hospital merger plan between Lifespan, the larger hospital group, and Care New England, the second largest hospital group. Lifespan, of course, with Rhode Island Hospital, Hasbro, Miriam, and their widespread organization. Care New England with Kent Hospital, Women and Infants, leasing on the same campus from Lifespan and Rhode Island Hospital, and Butler Hospital. Some would think they are hand in glove to come together. We'll talk about that a little bit later on with Attorney General Peter Neronha, who stopped the presses on this. WPRI reported on it.
Today we're announcing that we have denied the application of Lifespan and Care New England to merge.
Attorney General Peter Neronha on Thursday announcing he has rejected a merger of Rhode Island's top hospital groups. The Federal Trade Commission in Washington joining him in opposition and filing a lawsuit to block the deal.
Competition is really important. It benefits consumers and workers. It leads to lower prices, higher quality, and greater access. It drives innovation, and it increases pay for workers.
In a 150-page decision, Neronha warned the proposed hospital group would have an overwhelming advantage in Rhode Island. The report says the biggest hospital group in Massachusetts has 27% market share, and the biggest one in Connecticut has 31%. Lifespan and Care New England would have a combined 80% market share.
You put them together, what do you get? Number one, they're not competing with one another. Number two, who can compete with them?
In a statement, the hospital group's leaders said they were disappointed in the decision, but declined to spell out what they plan to do next. Critics of the merger, like House Republican leader Blake Filippi, cheered the decision as a win for patients and the public, but others worried about the future of Care New England, which owns Women and Infants and has faced financial challenges in recent years. The president of the state's largest healthcare union noted this was the second time Rhode Island leaders have rejected a potential merger partner for Care New England recently, saying in a statement, "We understand what they're against. Now it's time to clarify what they're for. Time is running out."
And so in some dramatic fashion, Peter Neronha, our Attorney General, called that briefing last week to lay the lumber down on this merger and to change again the course of history when it comes to modern medicine in Rhode Island General. Thank you for joining me. Appreciate it.
Sure, Dan. Good to be with you.
We talked about this on the radio a little bit last week. Give me the Cliff Notes. It was, I say it was dramatic in a sense. The decision is important, excuse me, in and of itself, but it was hastily called press conference. Give us the background on why you more or less alerted everybody in 45 minutes. Please come. I have something to say.
Yeah, part of it was driven by the FTC vote that morning, Dan. So the FTC didn't vote until that morning. And while our decision was independent of what the FTC did, I wanted to know what they were doing so that I could account for that when we issued our decision. And so they didn't vote until that morning at around 9:30. So that was part of it. I wanted to wait until I knew what their vote was, but I wanted to come out quickly after that so that I could explain to the public, the decision that we were making, particularly given that we were going to join the FTC if they did vote to block the merger. The other thing was that I learned from my Prospect experience, which is when Prospect Medical was trying to sell, sort of rearrange its ownership structure to let a private equity firm out of the ownership. They went to court to block my decision, which would have denied that change in ownership because they had real concerns about the health of those systems. They went to court to block that, and I didn't want to be in a situation where, my decision was effectively being called out, but I couldn't explain to the public why I was doing it. I felt the public was owed that explanation, and so by holding it for as long as we did, we eliminated the prospect of me not being able to say what I needed to say. I felt I needed to say on that morning.
All right. It was a lengthy briefing. You had a PowerPoint presentation. That PowerPoint presentation is available on the Attorney General's website for anybody who wants to see the argument and the narrative that you made. A couple of things on process before we get into the nitty-gritty on this whole thing. It seems that we had, well, it is true, but people don't really recognize necessarily that there were two tracks of review ongoing on this hospital merger, one being the Federal Trade Commission and then the state side, which is two-pronged, the Attorney General's office and the Department of Health. DOH has never weighed in on this and may not, now that you've laid the lumber down, so to speak. They may not decide to move their chips in because both have to approve it. But the FTC had already taken a stand on this and said that they were going to intervene on the federal side against this merger.
That's right. And so although they didn't, so what the way it works with the FTC is they have kind of a staff of career lawyers that then make a recommendation to the full Federal Trade Commission that then has to vote. They can overturn the recommendation of the career people or they can accept it. And so in this particular instance, they didn't vote until the morning of that press conference to go ahead and file an action to block the merger in federal court. So it's really unknown what they were going to do. You know, we had worked with them to acquire evidence because it didn't make a lot of sense to take effectively depositions from the same witnesses twice. You never want to do that. But their process was independent from our own. We matched the timing up because obviously if we were going to join them in the lawsuit, I wanted to issue my decision at the same time because we were discussing antitrust principles in the context of the Rhode Island Hospital Conversions Act. And the Department of Health was somewhat behind us in the process.
All right, so on the state side, speaking of the Hospital Conversions Act, the law requires the Attorney General to review mergers of this kind in the Department of Health. This is something that you take very seriously, and you loaded up your staff for this and your advisement on this. This was something that you were very, very, you're very quick, and I think you repetitively articulated how important that was to this, that this was not some fly-by-night seat of the pants and or political decision, that you brought more diligence to this case than perhaps the office ever has.
Well, look, you know, when I was campaigning and running for office, I knew in the back of my mind, I knew that the most challenging issues that we were going to face in this office was healthcare. You know, I've been a prosecutor for a long time, and I can handle criminal cases. It's what I've always done. But I knew the office had to be better when it came to healthcare, and we just weren't built to do it, frankly, at the time. We were understaffed in ways we were understaffed in other places too, to ill effect. So we had to build a really good team. The good news is that we had time to build it by the time this landed on our desks. You know, when Partners was down here trying to buy Care New England, that work was still in process, putting that team together. By the time we got to this one, the team was in place. And so, yeah, you know, I told the team when we were discussing this all for the last 6 months that whatever our decision was, it had to be great. In terms of it had to be in detail and it had to be thoughtful. And frankly, it had to be persuasive. And they did a good job of doing it. Yeah, so I really feel good about our decision, meaning this, whether you agree with it or not, I think that you can understand why we did what we did from the product that we produced.
Yeah, well, you know, we'll pause there, and when we come back, we'll actually talk about your rationale, because I think this is one of those situations where the arguments on both sides are credible and legitimate. I wouldn't call it necessarily a jump ball, but it's pretty close. We'll talk about the nature of the decision, who still is not happy with the decision, and where we're going from here when it comes to healthcare and the two big hospital corporations in Rhode Island. Stay with us with the Attorney General. Be right back. So, General, we were talking prior to the break about, you know, how close this call could be. You're saying at the beginning of your diligence, you didn't know where it was going to be. It's funny because we talked about this on the radio as well, and I discussed it with the listeners. It's one of those things where on some levels, it's self-explanatory, meaning two big companies that comprise 80+% of the business in the state are coming together, and some would just say, well, isn't that too big? And isn't that a problem for competition? Oh, well, we need to study it. And we got a 6-person panel and we do all this, blah, blah, blah. And we come back to you're saying, hey, by the way, there's two big companies and they're merging and they're too big and there's no competition. Yeah. Funny that way. You know what I'm saying?
Yeah, look, you know, I think there are two things going on, right? You want to keep an open mind in the beginning and also know that our decision could be hotly contested by the parties in the court. My decision can be appealed to Superior Court. So if we want to make a case as to why this merger posed anti-competitive harms to Rhode Islanders, we need to make that case because we're going to have to defend that decision. And so that's why we devoted the resources to it that we did. First of all, I wanted to make sure Rhode Islanders understood my decision, but it was also written with an eye to defending it in a courtroom. And so that's why we did the work that we did. And I think we really laid out a couple of things. Number one, what the market was, both product market and geographic market. We laid out what the anti-competitive standard is. It's 30% market share. That's presumptively anti-competitive. This was 80%. You know, the big dogs in Massachusetts and Connecticut, partners in Massachusetts, Yale, New Haven, and Connecticut are 30% or less. Really wanted to lay out why this was an antitrust potential, not a potential problem, was a problem. Then the question was, can we solve for it? And there are really two issues to that. One is, first, you got to understand what they're doing so that you can evaluate whether what they're doing is worth the price you're going to pay in terms of anti-competitive harm. And then can they pull it off? And then the remaining thing was, are there conditions that can solve for this huge market share? And we were convinced in the end that a couple of things. They had no plan to actually put it together, at least not one that they cared to share with us. They didn't demonstrate to us that they could pay to pull this thing off. They wanted 80% of market share without giving us those things, and that was just too big of a risk. And we didn't see conditions that could solve for the anti-competitive harm.
I think that's one of the things that a lot of folks are having trouble computing. You're looking at this thing for a year plus, and you literally come out and say, hey, we wanted more detail on what they were actually going to do to come together, and they didn't provide it. It's almost as if you're asserting there's a level of obstinance there. I mean, because anybody that looks at this from just a golly shucks point of view says, well, what do you mean? They tried to put it together and they couldn't explain, they didn't have a business plan. And of course, they argue that they gave you more than you're asserting, and that's where it gets murky. But clarify that, if you
I will, because I think it's really clear. So we said to them back in May, well, said it in April, said it in May, said it over the summer, said it again in September. I said it in person to both Drs. Finale and Babineau, and we said it in writing. It's really, really important to me to lay it out in writing because I didn't want there to be any misconceptions later. And at the end of the day, what we got from them in October was something called the Chartist Plan. And what the Chartist Plan says was, this is not a plan for integration. We will develop a plan later. Why is a plan so important? Well, tell me where you're going to deliver services. What's going to be added? What's going to be taken back? How are you going to do things differently? Where are you going to consolidate? Where are you going to expand? Because if I don't know that, I can't evaluate the benefits of this merger against the demonstrable market share harms.
Well, was it almost as if it's like, look, we're the experts, we're the doctors, we're the companies. You just look at this at 36,000 feet, and we'll take care of the details. And here you are going, wait a second, whoa, I might be a layman and a lawyer, but I got some doctors on my group here, and I want to dig in, and I want to actually be in your operational underwear. Forgive the term. Is that kind of where this thing was?
Right. So I'll give you the best example of that. Right. So we're talking about a huge share of primary care doctors in the state where this thing to come together between Lifespan doctors, coastal doctors, which are now part of Lifespan, and Care New England doctors, primary care doctors. There's this whole other group of doctors out there, the Brown physician practices. They weren't part of this merger. That's more market share. So my question was, well, what about those groups? And the answer was, we'll figure that out later. I can't, the reply to me was, we can't look 5 to 10 years into the future. My answer was, I have to look 5 to 10 years into the future. That's exactly what the law charges me with doing. And if you can't tell me what 5 to 10 years looks like, how can I give you 80% of the market share, which is presumptively anti-competitive? And that competition, Dan, matters. When they're competing, they're better. And we laid out a bunch of examples. Cardiology. Kent got better in cardiology. Lifespan responded and got better. Thoracic surgery. Kent got better. Lifespan responded and got better. Why is Kent competing with Rhode Island Hospital? Well, they're not that far off in beds. Kent Hospital has over 300 beds. They're a pretty big hospital. So that competition made both of them better. And so you want me to take that competition out of the marketplace? You better convince me why that's a good thing for the state of Rhode Island. And they chose not to do it.
Okay, when we come back, we'll talk about what you almost struck down a myth that I am guilty of potentially perpetuating. When we come back, we'll talk about it. Stay with us. Welcome back with the Attorney General, Peter Neronha. We're talking about this very important decision last week on the hospital merger. You know, I may very well be guilty in the sense that from a layman's point of view, and I have spent a lot of time on the hospital stuff. You've been good in terms of your review on these things. And, I've spoken with the executives, had them here on often occasion on COVID issues and merger issues. And one of the things that I think you could see, I would take my fingers and lock them together, thinking, okay, here's Care New England that has Kent Hospital, Women and Infants, and Butler, the psychiatric hospital. Ironically, Women and Infants is on the same campus as Rhode Island Hospital, and there's a rental agreement between them, a lease agreement. Lifespan, the big company, has Rhode Island Hospital, Hasbro Children's, and Miriam. But it felt like, in a way, there was a kind of hand in glove opportunity here because they kind of covered all of the bases from birth to end of life and even the mental illness part. And they would suggest that it's not only interlocking, but they were non-competitive. You shot both of those concepts down. Can you give me a quick overview?
Yeah, look, they clearly compete. If some of their own statements demonstrate that those things had to be redacted because of confidentiality concerns. So I'll go back to the former dean of the Brown Medical School, who was charged by Brown with sort of being, leading their role in this thing. He told us they're competing all over the place. And he's absolutely right. If you look at the overlapping services between Care New England hospitals and Lifespan hospitals, they overlap by over 93%. What does that mean? They're delivering the same services. Of course they're competing. And then when you get into the details, I already mentioned them, cardiology, thoracic surgery. Another example is, Kent was having some issues in terms of hospital-induced infections. So you go to the hospitals and you get an infection. And so those numbers were rising and it was affecting their quality ratings. Well, look, they were comparing their quality ratings against Lifespans. Said, we got to do better here. So they took steps to really improve that issue. But they're looking at each other, they're watching each other. And as a result, Rhode Islanders are getting better health care. That's just the reality. They told me when they came in, and I don't know that I'll ever get this phrase out of my head, that one was the hot dog and one was the bun. And our analysis just really demonstrated that that was not true. And look, I think behind all this, Dan, is this, that this office can't be a rubber stamp when it comes to regulating healthcare matters. When we do that, bad things happen. I think we've seen that in the past. And so I guess the only other thing I'd add is this, that the parties and others have claimed that conditions can solve for this market share. If that's true, I haven't seen those conditions. There's an avenue for somebody to try to put together what's called a COPA with those conditions to solve for market share. If we see that, well, we'll see whether that actually happens or not. I'm skeptical, but we'll see.
Well, well, this week, the indication is that they have said they are not, and folks, that make you to have you understand that there is a way where the state legislature can say, you know what, the heck with the law that we currently have. We're going to rewrite a new one. We're going to bypass what the federal folks want to do, and we're going to write our own new set of rules for these hospitals. And with the lobby environment and with these hospitals intent on getting together, that has always been something that has been, plan B or C or D or E. It seems like they've sworn it off and they've ended their current situation. And there are some suitors that are, at least one and potentially maybe a former suitor in Massachusetts, that will take a look at Care New England, because that seems to be the weaker financial entity here. We'll see. We'll pick that show up when it occurs. But there is a concern regarding going forward here. And Senator Whitehouse, who was very, very articulate about this over the course of time, and then aggressive on your decision, asking the question to you and to the world, yeah, now that you did this, General, how you can prevent some cutthroat for-profit barracuda to come in here and strip down Care New England, for example. The nurses association, the nurses union was very, very adamant in asking that question. But I found the Senator Whitehouse to be unique in the sense that he is a former attorney general. He is a former prosecutor. I mean, this guy is in your wheelhouse and neighborhood of peer. Tell me about that.
Yeah, look, we just disagree. I mean, Senator Whitehouse in that same statement said he had guardrails which could solve for this market share. He never shared those with me, and he didn't share them with the FTC. And I have a ton of respect for Senator Whitehouse, but I don't think he shared those guardrails, and I don't think anyone else is coming up with guardrails, because you can't solve for 80% of market share. How do we deal with for-profit hospitals? Well, we've already done it. We did it in Prospect. We got $80 million in escrow to keep those hospitals afloat. That's what this office did to fight off for-profit care. Candidly, other state agencies, including the Health Services Council, approved that transaction. We stood up to prevent it until we had $80 million in my hands to keep them going for 5 years and save jobs in those hospitals. So we can account for that. We can solve for out-of-state healthcare coming in here and owning a piece of our system. We can solve for making sure that charitable assets don't go out of state and make sure that Rhode Islanders can get great healthcare here. So we can solve for those things, Dan, but what we can't solve for is putting 80% of market share, because here's what happens. At that point, we don't have local control. They have control over us, and we don't want to be there.
All right, so I guess the emotion is the currency here. There were folks, including the nurses union, who were suggesting to Rhode Islanders that they be afraid. I'm paraphrasing, but that was a term. You know, be afraid of what's next.
Yeah.
The devil you knew in this deal was be the better than the devil you don't. My words.
Right.
And you kind of almost started us a little "Be Not Afraid" tune. You know, be not afraid. So as we wrap this up, we only have a minute. Tell us why we shall not be afraid here.
Yeah, look, we got work to do. But in Prospect, what do they tell us? Hospitals are going to close. People are going to be out of work. That didn't happen. They're open. Workers have jobs. We got $80 million to keep them afloat. We can get healthcare fixed in Rhode Island, but we got to get to work. We got to roll up our sleeves, not with bureaucrats, but with people who understand healthcare. That means people in the system. You know, we have a role as government leaders, of course, but you got to talk to workers, nurses, doctors. We can do it, Dan. We have to just have the will to do it. We can't fix healthcare on a transaction by transaction basis.
And in a way, in just a couple of seconds here, your indictment of the deal was more than tacit approval of the quality of healthcare in the state. Final thought.
Absolutely. The quality of healthcare is great. We can make how we pay for it better. We can make it affordable. We can make it more accessible, and we can continue to build quality. We don't have to give up and give 80% of the market share to one owner. Again, we lose local control in that scenario.
All right, General, appreciate your accessibility and your thought process here. We'll follow this story because I think the chapters are not quite written yet. Appreciate it, though, very much.
Agreed. Thanks, man.
You bet. Final word, and we come back. Stay with us. There will be more chapters on this hospital merger situation, and we'll follow it here and on WPRI weekdays 3 till 6. Fingers crossed that things get better in Eastern Europe. Also something we shall be following closely. You have a great weekend and rest of the weekend and a terrific week to come. Spring is coming. Have a great night. Bye.